Hi everybody, I'm just here real quick to wrap up Breast Cancer Prevention Month here on the Wise Women page. We've been talking about all the things you can do to prevent breast cancer in your life, including eat more vegetables, increase your fiber, exercise, fix your cycle, clean up your life from this chemical soup that we live in. And so today I just want to mention one more thing that you may or may not have linked with breast cancer before, and that is viruses. Okay, so for 20 years now, they've been studying the link between certain viruses and breast cancer. And there are literally a gazillion viruses out there. We don't know them all, we cannot test for them. But in general, when you look at the research, you will see three main viruses that we can identify as having a link to breast cancer. And those would be Epstein-Barr, which you may know as causing mono, HPV, which is more commonly spoken in reference to cervical cancers, and mouse mammary tumor virus, which I realize you probably haven't heard of that one, not commonly talked about, but it's actually something that we see a lot in the research for this problem. So what they're actually doing is they're biopsying and looking at the tissue of breast cancer patients versus healthy tissue, and they're finding a much higher viral load of these certain viruses in the cancerous tissue. And so they're trying to come up with some more studies, and they're trying to look at this further, but for now that's the information that we have. We also know that the women that this is found in a higher incidence are the women who are young when they're diagnosed with breast cancer, and they typically have a very invasive and deadly form of breast cancer. So this is really important. They think right now about 15% of breast cancer cases could be viral linked. Okay, so what do we do about this? We know that viruses are not responsive to antibiotics. So what can we do to reduce our viral load? Well, that's what we're going to talk about next month on the Wise Women page. So stay tuned for information on stealth pathogens. Those are the critters that can live in our body and hide. So we're talking about bacteria like Lyme, we're talking about parasites, we're talking about Epstein-Barr and herpes, all the different herpes viruses. Parasites, molds, yeasts, all sorts of things that can hide and give us problems. And the links for stealth pathogens with disease processes are really coming out hard and heavy in the research right now. So you're going to see a lot more of this soon. And you want to pay attention to this because we're talking about cancers, we're talking about links with fibromyalgia, chronic fatigue, autoimmune disease, especially Hashimoto's, things like this. So stay tuned on the Wise Women page for information about stealth pathogens next month. Thanks.